Nobody has ever died from baldness. Nobody needs to treat their hair loss, and absolutely nobody needs a hair transplant.
There's such a mixture of patients, both from an age perspective, from a geographical perspective.
If you're perfectly comfortable with hair loss, clearly you're not going to come and see us here.
Transplant patients come from all walks of life.
Surgeons, professors,
tradesmen, carpenters,
politicians,
high-flying executives,
clergymen, nuns.
Women too suffer from what's called genetic hair loss.
The ratio is roughly 10-1.
We also would see children, congenital birth defects.
You don't know exactly who's going to walk in the door.
Road sweepers, hedge trimmers,
Patients who've had burns, patients who've lost an eyebrow.
architects.
It's not something just closed off to the rich and famous.
Every patient that walks through our door is essentially our celebrity for the time that they're with us.
When it comes to hair, everybody's equal.
So you might find somebody who's outwardly the most confident person, but they're racked with self-esteem issues over their hair loss.
It's not a vanity issue.
Doesn't matter where you're from,
You name it.
it's anybody.
Hair loss is about the man in the mirror and our perception of ourselves.
The problem of hair loss has been with us for centuries, and while there is still no cure, there is a solution. The team at HRBR provide an unrivaled world-class service that ensures a natural-looking and totally undetectable result. The surgical team at the purpose-built facility at HRBR provide a bespoke service that sets international standards of best practice. It's the only hair loss clinic worldwide where you will be treated by a qualified consultant surgeon, supported by a 20-strong team of highly skilled doctors, nurses, and specially trained hair transplant technicians.
I get a lot of men who say, Maurice, I'm not losing sleep over this. It's not a big issue for me, but I don't want to ever see a bald man in the mirror. So can we do something that will maybe improve it a little bit, but basically keep the image that I have, and it'll be there permanently for the rest of my life? They would prove to be the majority of the patients we operate on, and there's a huge amount we can do to help them.
For those who choose HRBR, the process begins with a private consultation with a qualified doctor. A hair transplant is not appropriate for everybody, and it's important the decision is made following a professional clinical assessment and an appropriate period of reflection. Part of the meeting involves taking a medical history, a hair loss history, and doing a thorough physical examination of the hair and scalp. A consultation summary report will provide the patient with all the information he or she will need in order to make an informed and properly considered decision about whether to proceed. If the patient is suitable, a treatment plan will be prepared and tailored to their precise needs. This may not necessarily involve surgery, but a course of FDA-approved medication.
There are basically two remedies for hair loss. There's the medical treatment for hair loss, and then there's the surgical treatment for hair loss. And people are either appropriate for medical treatment or surgical treatment, or a combination of the two.
We see some people who've come in from other clinics who've had some operations done at quite an early age, and oftentimes the results can be less than satisfactory in those patients because your hairline hasn't developed at a mature level until your mid-20s. Operating can be detrimental, and it's oftentimes worse than having no surgery at all.
When we see people back on an annual basis, we can really tell almost follicle by follicle how static or progressive their hair loss is. And once people do reach that point where either they're noticing a change or a re-deterioration in their hair, or we're noticing it photographically, that's the time when we can discuss other things. And at that point we can either slightly increase the medication, and that can hold people off for another little while, or else we can start talking about transplantation, and we're really guided by the patient on that.
Although discussed more openly these days, hair loss is not always an easy subject to talk about, so we plan our appointments carefully to ensure patients don't meet each other. All patient information is held in a secure, password-encrypted database, ensuring total confidentiality.
When I see a patient for consultation, they're looking at me and saying, can I trust this man to look after my appearance? But I'm also assessing them on their suitability for transplantation. Not everybody is suitable. And One of the key issues is obviously have they got sufficient donor hair to make a significant difference to their area of hair loss and where they're thinning or going bald. But more importantly, are their expectations realistic? Some people have the impression that we can give them back a full head of hair, and unfortunately that's not possible. In a hair transplant, we're not creating new hair. What we're doing in actual fact is redistributing the hair from the back and sides of the scalp where the patient has too much of it into the areas of thinning on the top where there's too little. Men who lose hair due to male pattern hair loss primarily lose it in the frontal region, and then they'll get a little bit of hair loss in the crown, and then in some men it all joins up.
The main culprit is a thing called DHT hormone. The area at the back of the head, so that strip behind your ear running across from ear to ear, is less susceptible to the effects of the DHT hormone, and that's what we consider to be the safe area for taking hair from.
When that hair is moved from the back area up into the front, it'll grow there permanently for the rest of the patient's life. And that's the whole principle of hair restoration. We move the roses out of the back garden into the front garden.
HRBR are experts in the two techniques used in removing hair grafts from a patient's donor area. These are known as follicular unit extraction, FUE, and follicular unit transplantation, FUT, or strip method. FUE involves the removal of hair grafts one by one. FUT, on the other hand, involves a strip of hair-bearing skin being removed, which is then carefully prepared into individual hair grafts by a team of highly skilled technicians working with powerful state-of-the-art microscopes.
In reality, when a man is going bald and the man in the mirror is giving him grief over this, just a small amount of hair is sufficient to actually make him feel much, much better about himself. You don't notice hair loss until you've lost 50%. So if you reverse that principle, you don't need to put 100% of the person's hair back on top of their head. By going in around the 30 to 40% replacement, you can create the illusion of fullness.
Regardless of the technique used to extract the grafts, the process for transplanting them is the same. Tiny incisions are made in the area to be transplanted. Thousands of grafts may be transplanted in a single day.
Hair follicles come in various sizes, so it is vital that we transplant the hair follicles based on their size. We tend to transplant the finer hair follicles, the ones with one hair in them, at the front, whereas we usually keep the larger follicles with the four towards the rear of the transplant, for the simple reason that in nature that's how hair follicles are found. So you have to make sure that your transplant is exactly like the normal distribution of the hair follicles.
In the old days, clumps of hair were taken out and just put straight into the head. So they grew at a non-natural angle and they didn't look normal. Whereas now, by doing individual hair follicles one by one, we can transplant them following the angle and direction of the patient's own hair, and we just put the single hairs along the hairline here, and then the two hair follicles go in behind that, and then the larger hairs, the 3s and 4s, go in that. So you get this very nice transition, natural look to the hairline, which is obviously the key area.
And everyone has a flow to the surface of their hair. If you shave your head, you can see the pattern of flow of your hair follicles. So there is definitely a little creativity and an art to matching that when you're back in doing a transplantation on hair that has gone.
It's important that the design of the hairline is appropriate to the age of the patient and that any future recession is accurately assessed. If this is not done correctly, in years to come, the hair transplant will start to look unnatural as a patient continues to lose their non-transplanted hair as they age.
One of the healthiest things is, my age group, it's still a taboo subject. The middle age group, they'll chat privately between one another, but the young men now, open discussion about their hair loss.
As men become more open and vocal on this subject, the industry surrounding hair loss is burgeoning. Whatever you are considering, it's vital that you take time to do your research and look at all the different options available.
There are a lot of alternative therapies available on the market today for hair restoration. If you go into any hairdressers or pharmacy, indeed, there's a whole shelf of products that are claiming to restore your hair completely to what it was. It's interesting that in 20 years that the International Pharmaceutical Protocol for hair restoration hasn't changed, and we're really using exactly the same medicines now as we were then, despite all these new things coming and going on the market.
Do your homework and then visit a few clinics and then decide yourself, what is it I want to do? What is it the man in the mirror wants? And if somebody tries to persuade you to treat your hair loss or have a hair transplant, leave the room immediately.
This DVD is specially designed to guide you through the hair restoration process at HRBR. It cannot replace a consultation, but offers a step-by-step guide to those considering this treatment. You will follow the progress of one of our patients, Mark Berry, as he embarks on this life-changing procedure and receives over 3,500 grafts to the top of his head using the FUT technique.
When somebody comes to see me at the initial consultation, it's very seldom I hear the words self-esteem or self-confidence. But when the patient comes back about a year later when the hair is fully grown, I constantly hear the terms self-esteem, self-confidence, contentment and peace of mind. We're all looking for, in theory, happiness, but in reality, what we are all looking for is a sense of contentment in our lives. And if you ask me to summarize hair transplantation in one word, it's contentment.
Oh my God. I think it's actually amazing.